Antibody testing for SARS-CoV-2 or COVID-19. I'll tell you what we know, what we think we know, and what we don't know. If you go back to mini med school, antibodies are basically proteins that our immune system makes in response to being exposed to or infected with a pathogen, let's say a virus. There are many viruses that you can go into a doctor's office and ask for a simple blood test to get your antibodies checked. And that can be helpful in revealing whether or not you've been naturally exposed to a particular virus or whether you have been vaccinated and responded to that vaccine by building or making antibodies. This is still a 6-month-old new virus that immunologists are working on around the clock. And right now, really a lot more questions than there are answers. This is probably the #1 question that I'm getting about COVID-19 is, should I get my antibodies tested? Right now, the short answer to the question of should you or should you not get your antibodies checked, basically just out of curiosity, is you probably shouldn't, and I'll tell you why. Any result with this antibody blood test should not change your behavior with respect to social distancing, hand hygiene, and wearing a face covering or mask right now, which is for the protection of those around you. In medicine, one of my favorite sayings is you shouldn't do a test unless you know what you'll do with the results of that test. There's a chance that the results of the test may not be accurate. That's definitely the case right now with the blood antibody tests that are available here in the US. Every test has its false negative, false positive, and this test is no different. Exceptions to that are if you had tested positive for COVID with a nasal swab, you had classic symptoms, and you're interested in potentially enrolling in a clinical trial to donate convalescent antibodies, convalescent plasma for the potential research or benefit of helping someone else. There is some evidence that a previous infection with SARS-CoV-2 does give you some immune protection, at least for the short term. We've heard Dr. Anthony Fauci talk about this. In early clinical trials, testing of the vaccine, there has been shown to be some kind of blocking ability or immune protection with vaccine testing. So there is reason to be optimistic. There are no immunologists, no infectious disease specialists, no public health officials who are ready to say for sure that it's impossible to get reinfected. Right now, antibody tests are not used, should not be used, and are not indicated to diagnose active or acute SARS-CoV-2 infection. According to the nation's top infectious disease specialists, top immunologists, top public health officials, we don't know that simply having antibodies to SARS-CoV-2 means that someone is definitely immune. There is reason to believe that yes, someone will be immune against reinfection for a certain period of time, but for how long and how protected, we don't know yet. I've been in communication with Dr. Stephen Hahn, the head of the FDA, Dr. Anthony Fauci, the head of the NIAID. The hope is that this vaccine against COVID-19 will be a one-shot vaccine. However, we don't have enough data yet because the vaccine is only 6 months old to tell us with mutations, with evolution, will this virus change such that new strains need to be included periodically? We just don't know yet.